Black Americans in our survey report being 10 percentage points less likely to have positive perceptions of doctors than white Americans, and 9 percentage points less likely to have a favorable view of nurses and physicians' assistants. Mistrust of the healthcare system exists among Black Americans partly because of awareness of racism in medicine. Racist beliefs led to once accepted practices of medical experimentation on Black and enslaved people, as well as the exploitation of Black people for research without their consent. The trauma of that type of structural racism being a normal part of medicine has echoed through generations, and varying degrees of racism still exist in medicine today. Mistrust is amplified by lack of representation. Only 1 in 4 Black Americans in our survey report seeing a provider that shares their race, and only half of Black respondents said they felt that their last provider was familiar with Black patients. While our survey allows us to quantify these sentiments, actual patients can speak to the challenges of looking for care they trust. For example, Adrienne Hibbert, founder of the website Black Doctors of South Florida, told NPR about her challenges working with a white obstetrician during her pregnancy. "I want someone who understands my background. I want someone who understands the foods that I eat. I want someone who understands my upbringing and things that my grandma used to tell me." For Jayla, a patient seeking STI treatment who sat down with CBS News, a lack of representation led to being dismissed, and misdiagnosed, by a provider. "I have to be the angry loud Black woman making a scene for you to do something. I used to want to avoid that, but when it comes down to my health, I'd rather you be uncomfortable and me not be dead," she said.